One of the unique things that we do at the British Institute of Human Rights is to work collaboratively with organisations to put human rights into practice in their everyday work. So we support public sector organisations to really put human rights into the heart of their service delivery. And we support advocates to use human rights to make the best case possible for the very vulnerable people that they're supporting.
Our job is to empower clients who are experiencing mental health difficulties to be involved in their care and their treatment, but we're not human rights experts, and that's where BIHR come in. One of the main things that came out of that was some really useful resources, and in my previous role as an advocate I used these booklets a lot, and so I used to actually carry this booklet and I found it really useful. So one example of where our advocates have used human rights in their work is a situation where a young woman was in hospital as an informal patient. So what I mean by that is she was not detained under the Mental Health Act, and the staff were not allowing her to leave the ward, even to go for a coffee or to the shops. And their argument was that they had a duty of care to her and that she wasn't safe to leave. After speaking with her advocate and explaining to her advocate that she wasn't happy with this arrangement, her and her advocate agreed that the advocate would speak to the ward staff and point out that actually this is potentially a breach of her human right to liberty. But after some discussion, and because the advocate felt that had that confidence in using the human rights language and using that argument because of our involvement with BIHR, that went quite smoothly, and after one meeting, the ward staff agreed that Jenny could leave the hospital accompanied at first. Within a week she was actually leaving the hospital unaccompanied because she'd been able to prove to the staff that actually she is safe.
So the first time we worked with the British Institute of Human Rights was at a training day that they provided for us in Liverpool. They came to talk to our team and explain to us what human rights were all about. I think BIHR really listened to what we're saying and tried to understand where as an organisation we're coming from.
And it's that knowledge base that's empowered me to be able to empower the people who access the service that I work for. An example of that is one of the people who's been through the many groups we've run spoke to us about how she wasn't happy with the people who provide support services for her. By the end of the group she felt empowered to bring this up at a review, and as a result she was able to change the support team to one that she is comfortable with, and that's enabled her to move on with her life.
As an advocacy organisation, I think we did have a tendency to focus on the negative aspects of human rights when they were breached or were interfered with by perhaps the NHS or perhaps a local authority. And one thing that I really learned from BIHR was that there is also a positive aspect to human rights. So where there is a positive obligation upon public services to uphold and further the rights of the people that we work with. And I think that was a really important shift in our approach in using human rights.
So for services like ours in healthcare, it really helps us to be able to try and take some of the concepts of the Human Rights Act, apply those in a healthcare setting and not get overly technical or overly jargonistic, but have real kind of ways of working. And I think BIHR are really skilled actually at kind of bringing that to a healthcare setting rather than putting in a series of parameters that we're then expected to conform to in the way that we work. We felt really listened to by them, and we felt that they really kind of tried to understand where we were coming from.